Here at Mojo, we have been focusing on different states and looking at how different states have a different approach to battling the spread of the coronavirus. Let's go across now to Telangana. Telangana, by last count, remains the fifth most impacted state by this contagion, and therefore it really has a challenging situation. And we're joined now by Rama Rao, known as KTR to all of us who've been in media for a long time. He, of course, is the head of his party and a nodal minister in charge of all of these battle plans, as it were. Welcome to the program, Rama Rao. Tell us a little bit about what the latest situation is first on the ground in Telangana.
Firstly, Barkha, thank you for the opportunity. Let me quickly point out, over the last 3 days, in fact, we've been noticing a downward trend. All the people that were in quarantine, in fact, have been allowed to leave. About 26,000 people. Of course, they have been advised home isolation and subsequent testing will follow. But the good news is it appears like there is a downward trend. And another piece of good news is also that there is no community transmission that we've noticed. So it appears that lockdown, the containment measures that we've taken, all of them are now paying results. And hopefully over the next few days, we'll further, see a rapid decline and hopefully no further transmission. So it looks good, touch wood, but we're keeping our fingers crossed, bracing ourselves. But we followed a three-pronged strategy, when it comes to the whole COVID, because this is uncharted territory for all of us, unprecedented times. Nobody could prepare and brace themselves for a pandemic of this magnitude.
Yeah.
Even the first world, as we all know, is yet to come to terms with the scale of the magnitude of the problem. So therefore, we followed a three-pronged strategy. We said, firstly, the most vulnerable section in our society, they ought to be taken care of by the government. So in fact, Telangana was the first state, in my opinion, which went out and called, in fact, all the migrant workers, partners in our development, in our state development. Our chief minister took a very humanitarian approach, and he promised ration, irrespective of the fact that you could or could not have a ration card in the state. You could be a domicile of the state, or you could not be. You may not be a domicile, but you still will get full ration, and also support for essentials. That's the first thing we did. The second thing we did, we looked at containment, because a country like United States today, in spite of being a first world country, a very affluent country with good medical infrastructure, they are not able to come to terms with this. So we said containment is the only solution. So we said we'll contain it as effectively as we can. And in fact, even before Government of India announced a lockdown, we went ahead with our own measures and we tried to do effective containment. The third and most important thing, should there be infection, should there be a spread of infection, what do you do? What we did for that was we braced ourselves and we prepared our medical infrastructure for curative should there be infection. And today we have more than 15,000 beds readily prepared. We even have prepared, we've even converted some of the existing buildings into ready-made facilities. And today we have a swanky new about 2,000 bedded facility in Hyderabad. So fortunately, now the numbers are in the mid 500s. We hope that they will continue to come down. Right. Already 50 people have been discharged. They've gone home. And in spite of the fact that there were 12 deaths, the active number of cases remains around 500. Okay. So we hope and praying that this will come down.
That is good news to hear, but then that would lead me to my next question, which is that in the sort of light of the fact that the numbers seem to be getting contained, that you seem to have a fix on a community transmission, why does your state want an extended lockdown? Why are you not considering at least a partial lifting of this lockdown?
It's important that we don't let the good work that was done in the last few weeks dissipate again in no time, because we've witnessed scenes of celebrations after Janata Curfew. We've witnessed scenes of celebration after the Diya ceremony that Honorable Prime Minister wanted us to do. So therefore, we do not want to give a false notion of security or false notion of relief to people that this problem is gone away forever and we can all breathe easy. It's not going to be business as usual. This is a new world order that we've all discovered. There are going to be changes. There are going to be, things have to be done differently. So therefore, a complete removal or complete relaxation of lockdown is something that's ill-advised. But at the same time, like you pointed out, maybe certain other activities that need to be done, possibly have to be considered by the government. In fact, we have our state cabinet meeting tomorrow. right after the Prime Minister's video conference with Honorable Chief Ministers. So hopefully we'll take some of those measures tomorrow.
So let me give you the argument made by industrialists like Rajiv Bajajs in an interview to me and also writing later in the newspapers. He said that we can't shut the country down. We can't shut our states down every time there is a virus, because also there is no evidence right now of a vaccine or a cure. And he suggested that maybe everybody has to learn a new protocol. Maybe for the next few months, we all have to wear masks when we go out. Maybe we have to keep that social distancing, but allow economic activity to resume, allow economic activity to revive. This is Mr. Bajaj's argument. How do you see it, KTR?
Well, there have been a lot of arguments, Barkha, lives versus livelihoods, and how a country like India, which is growing, which is developing, cannot sustain a prolonged lockdown. All of these are important to consider, but Honorable Chief Minister of Telangana, in fact, on record, has said, economy can be revived, but lives cannot be revived. No matter what we would want to say, what we would want to believe, I think the argument between lives and livelihoods, it cannot be a simple argument. It is complex in a diverse country like India. In fact, there are several reports also of migrant workers and others for lack of livelihood options, suffering. So therefore, we have to strike a fine balance without a question. I agree with Mr. Bajaj partially, but of course, I think what has to be allowed versus what cannot be allowed is something that governments have to figure out and define. But at the same time, like Mr. Bajaj also pointed out, the most vulnerable sections among the society, the age group, etc. Maybe you confine them, maybe you don't allow them to move about freely. But at the same time, those sections that have been found to be healthy, to be less vulnerable, let me put it that way, I think should be allowed to work. So that fine balance, I don't think the world is stricken yet. So we'll have to find.
So would it be fair to say that you would be in favor of a partial lifting of the lockdown, but with borders closed and interstate transport closed? Would that be a fair reading?
Well, I would put it this way. In fact, those clusters which are hot, which are red, in fact, where we have seen widespread infection, they have to be contained, and there has to be a complete lockdown there without a question, because we don't want this to be spreading. Fortunately, it hasn't spread yet. So community transmission has not happened. Where we've seen the problem, I think the lockdown has to be complete. But then in other areas where we haven't seen it, we, I think, can go for a partial lockdown, as you pointed out, with strict discipline, self-discipline, of course, and also social distancing measures and other protocols the world is following.
Now, your state has opposed randomized testing, and you yourself were on record saying that one of the reasons to not do this is that it arbitrarily creates panic. Where I'm sitting in Delhi, the Chief Minister has taken a somewhat different approach. He wants more random testing. And, there is a kind of, India hasn't got a fix on this yet. A lot of people believe as a country we're under testing. Why are you opposed to randomized testing?
I saw the statement of Chief Minister of Delhi, Mr. Kejriwal. He said 1 lakh people would be tested. But my question to you and to all the Delhiites is, out of the 4 crore population in Delhi, which 1 lakh would you pick? In fact, I am all for cluster testing, because 1 lakh out of 4 crore is 0.04 or 0.4%. Is that good enough? I do not think so. And secondly, let me also point out, the world is currently in a fear psychosis. See, if you allow for 1.3 billion people to be tested, firstly, we do not have the wherewithal, we do not have the infrastructure. Secondly, as it is, the world is in a fear psychosis. And this might, in fact, this indiscriminate testing might lead to a situation where a lot of fleecing, a lot of private labs, making hay while the sun shines, could lead to a panic and a pandemonium, which is worse, if you ask me, than not testing at all. Now, we are not opposed to testing per se. We are for testing in clusters where we have already witnessed infection. We are for a 360 quarantine of those patients and anything around them. But to go beyond when there is no community transmission at this time is not advised. Secondly, we're also seeing what's happening in the US. A state like New York is unable to meet the infrastructure requirement. A country like India with 1.3 billion population cannot afford it. And lastly, Barkha, let me also point out, there is also a theory. Again, this is a hypothesis, not even a theory. There is also a hypothesis that in about 60 to 65% of the people who are infected, the infection would remain latent, and even without them realizing, it would just go away. So, should you go for random testing, and should you find somebody is positive, he or she may not need treatment actually in effect. But there could be somebody else out there who actually absolutely needs treatment. And should there be a situation where you have to weigh and measure and say who will get treatment versus who will not get treatment because you don't have the infrastructure availability, then it will become a bigger problem for a country like India. Because we've seen that in Italy.
Let me give you a counter argument. One is that you may not know about community transmission till you test more. That's one argument I've heard. The second argument, you're absolutely right. There may be any number of us who have actually already developed antibodies, which means we've got the infection, we fought it, we're fine. And certainly no medical resources should be wasted on us. But it could be useful, at least to segregate and identify clusters if you do more testing. That's the argument in favor of more testing.
Cluster testing, without a question, I think I'm completely on the same page as you are. Cluster testing is a must, especially in those clusters where we've witnessed it. With respect to community transmission, my argument and our argument has been, in a country like India, with a population density, and in the current social media world that we live in, I do not see a situation where somebody is infected and we don't know about it. It will come to the fore in no time. Governments cannot hide these infections, hide the spread of disease. This whole argument about under-testing and therefore a lot of these cases going undetected. The mortality rates are measured, and mortality rates are very much monitored by governments across the country. I'm not just talking about a state and central government, local governments, the panchayats, the municipalities, the zilla parishads, the mandal parishads, the block. So therefore, to assume that infection is widespread but India is under-testing, therefore under-reporting, is absolutely inaccurate in my opinion.
Okay, tell me how your state has dealt with the Tablighi Jamaat. We now know that 30% of cases in India are linked with the Tablighi Jamaat, and there's an effort on to get people to volunteer that they were present there. So how have you dealt with this particular dimension?
Well, in fact, in our state, more than 50% of the cases are related to Tablighi Jamaat. So it's unfortunate. Had this incident not happened, I think we would have been done like Chhattisgarh, for instance, with this whole pandemic. But unfortunate it has happened. But to actually create phobia around a particular community, again, is something that we have taken very seriously, and we have completely been strict about. We have appealed, and we've identified, we've done using our extensive network of police and also our municipal staff. We've identified nearly 1,200 people who've attended Tablighi Jamaat in Delhi. We've quarantined each and every one of them. And again, doing a 360 around them, we've identified more than 5,000 people, again, who've been quarantined also. And we've ensured that every single one of them that has attended has been quarantined and has been tested. Yes, there's still more people out there who have not reported or who have gone missing. We are tracing, we are actively pursuing. We have appealed to the community elders, we have appealed to other political parties and to citizens to come forward and give us details. And so far, I think we've achieved a good degree of success, because there is no, again, widespread community infection. Hopefully, in the next few days, we'll even see the numbers decline even further, because yesterday only 19 cases were reported. Hopefully, going forward, it will come down even further.
So you're saying more than 50% of cases in Telangana have been linked to the Tablighi Jamaat, but you make the important point that this cannot become a reason for Islamophobia. One of the feedbacks we are getting from community health workers while we've been reporting is that because of this whole larger politicization of this conversation, the Muslim community is not sharing as much data as other communities. There is a kind of fear factor that has crept in. How are you addressing this, and is this your feedback on the ground? In particular, in Hyderabad, you have a large number of Muslims, right in the city where you're in. How are you dealing with this?
Well, it is fair to say that there is a bit of a stigmatization around every patient, not just the fact that they're Muslim, Hindu, or Sikh, or Christian, but there is a lot of stigma attached to the fact that you are a corona or a COVID positive person. Firstly, there is that stigma. And secondly, of course, especially after the Tablighi Jamaat and the way this social media has played a havoc around a particular community, that is Islam and Muslims, there has been a bit of reluctance. But fortunately, in our case, we've identified every single person that has attended, and we've been able to trace every single person and also do a 360 around them. So we did not have to, resort to any other measures, either coercive or sort of a carrot and stick model where you offer a reward for somebody to come forward and test. We did not have to do any of that because our machinery very effectively went about identifying every single person, and we've been able to trace every one of them. Okay. There is, of course, that some still could be out there because there could be a secondary infection. Sure. They have to be traced, which is what we're after now.
Okay. Now, tell me this, talking about carrot and stick, as you said, there are states that have actually offered money. Odisha has incentivized quarantine, for example. Chief Minister of Telangana took quite a different approach, at least in the early days. There was a statement where he said there will be shoot-at-sight orders if someone breaks this quarantine. Why did Chief Minister feel the need, Mr. KCR, to take this kind of approach? Because one of the confusions on the ground is that a lockdown is not a curfew, or at least isn't necessarily a curfew. And police gets very confused. And therefore, we've seen even essential services, when they move, police, at least in our part of the country, has shown them, their wrath, danda dikhaya, as they say in Hindi. So why was this statement issued about shoot-at-sight orders?
Well, Barkha, let me clear the confusion on that because, he did not say that there will be a shoot-at-sight order issued. All he said was if people do not cooperate or do not take this pandemic seriously, there might come a situation where the government will be left with no option but to issue a shoot-at-sight order, because if it assumes the proportion that we see in the West, in say America or Italy, and in a country like India with very inadequate medical infrastructure, we will have no choice but to resort to some extreme measures, is what he was alluding to. But unfortunately, as always, media in Delhi picks up only the tidbits that they want to report. And, we are always victims of distance from Delhi. And I've complained, I've said this enough. I think, you should step out of Delhi more often, and you should meet with people outside of Delhi more often to get a clear perspective.
Well, as soon as the lockdown lifts, I'm certainly coming to meet you, KT Rama Rao. One final question. In my travels, reporting on the ground, and I've traveled extensively, at least across North India. Unfortunately, no other part of the country is possible because the airlines are shut. We have found that undocumented Indians, people who do not have a ration card, single women, widowed women, these are people who simply are outside the safety net of any welfare scheme from either the center or the state. And when they go to a ration store, they're turned away because they don't have the biometrics, they don't have the card. What are you doing for these people?
Barkha, we've taken a radically different approach to any other state in India. And in fact, our Chief Minister, like I pointed out, called every migrant worker in our state who's working, irrespective of the domicile, could be from Bengal, Odisha, Bihar, Chhattisgarh, wherever. He said they're partners in the development of state without whom our state cannot progress. So he announced a package almost 15 days ago, ahead of any other state in India. He called them, he appealed to them directly in Hindi, in their own language, which they will understand. And he said, please stay put wherever you are. And that's why you didn't see the scenes that you've seen in Delhi or elsewhere in the country, where hundreds and thousands of people were flocking to bus stations and even walking on by foot. Yeah. So we give them free ration, every one of them. We have organized more than 600 camps across the state of Telangana, and more than 4.5 lakh workers have been, given shelter in these various camps. They've been given free ration. They've been given medical attention. They've also been taught social distancing. They've also been given sanitizers, Detolls, and everything that is required. And they've also been given money for essentials. So therefore, we've mitigated this issue temporarily, that is, by way of ensuring that they don't have to move. But there is one aspect that we cannot overlook, Barkha. This whole fear psychosis that has gripped the world कि हम मरने वाले हैं. एक बार कोरोना आ गया तो हम मरेंगे, मर जाएंगे. तो लोगों को ये लगने लगा कि अगर मुझे मरना ही है तो मैं अपने गांव जाके मर जाऊंगा. तो दिक्कत बात की नहीं है कि उनको राशन नहीं मिल रहा है या उनको कोई तरकारी नहीं मिल रही है. बात इस हद तक पहुंच चुकी है कि मेरे अंतिम दिन है तो मेरे अंतिम दिन में जाके हमारे गांव में, हमारे शहर में बिताऊंगा करके लोग जा रहे हैं. तो we had to arrest that tendency. To that effect, I think media also played a bit of a spoil sport in spreading this fear that जिसको भी कोरोना हो जाता है उसके पास कोई और चारा नहीं. In spite of the fact that the fatality is only 2% in India at least.
Yeah,
Unfortunately,
that's a very important point कि वो जो एक ह्यूमन इंस्टिंक्ट होती है घर जाने की, अगर आपको लगता है आपको कुछ बहुत भयंकर होने वाला है, तो आपको लगता है कि मैं अपने परिवार के साथ वो अंतिम दिन बताऊं. And it's fantastic that you've been able to contain the exodus of migrant workers that many other states, especially in North India, have not been able to. How is the coordination? Absolutely, the last question. How is the coordination between the states and the center? We've had some chief ministers say there should have been more time to plan for this. We wish we had more notice for the lockdown. How is the coordination between the states and the center?
Well, in this case, I don't think we can complain about coordination because, like I said, Barkha, these are unprecedented times. I don't think in our lifetimes we'll see something like this ever. We'll not be, talking on Zoom. Possibly we'll be talking on something else. So therefore, these are unprecedented, uncharted territories. So to accuse or to even, level political accusations at this point does not make sense. Yes. Could things have been better? Of course, yes. There is always scope for improvement from our side, from their side. But these are not times when to nitpick and to actually pinpoint, to finger point. I think government of India is doing its best. We are doing our best. Media is helping. People are helping. As a country, as a developing country, can we afford this? No. But do we have a choice? No again. So therefore, we live in very interesting times where we have to find our own solutions, our own recipes, our own formulas to come out of this. We cannot ape America. We cannot ape Sweden. We cannot ape Iceland. They're different countries, different economies. So unprecedented, uncharted, unknown, lots of unknowns, uncertain times. So we are dealing with it as each day progresses.
I think that's well said. In fact, it's very well said. It's not the time for partisan politics. There will be time for all that. There will be elections. We will go back to that time, but our world order has changed. KT Rama Rao, we wish you all the best. It's good news, as you said, that there's been containment, no spike in the numbers when I checked today. And I think that's very, very good. Thank you so much.